Much. It is now 8:50. At least 2 people in Hamilton County have now contracted the West Nile virus this summer. We're on your side this morning with a deeper look at what you need to know to keep your family protected. Mike Samet is with us this morning with Hamilton County Public Health. Appreciate you coming. It's always good to see you.
Good to see you, Brian. My pleasure.
You know, what's interesting about this disease is the majority of people who get it don't know it. Is that what we're really hearing?
Well, the majority of people, and it's important to point out that the vast majority of people who contract West Nile will develop no symptoms. That's 80% of the people out there.
So what is the best plan? I know one of the phrases being used is drain, dunk, and protect.
Well, draining standing water on your property is probably one of the most important things you can do. There are lots of hidden places for standing water. Your basketball goals, portable basketball goals, bird baths need to be changed out frequently. All the places that you would have standing water in your yard, you should really change out often.
And I understand dunk means you can get something to put in the water.
Sure. If you have standing water that you can't change out, most hardware stores around the tri-state region will sell a product called a dunk, and it's harmless to pets and harmless to the environment. You put it in and it just takes care of mosquitoes at the larval stage.
And you know, in the commercial break just before this, I was looking at the most recent numbers from the CDC, and this is where the numbers are at for cases. In Ohio, there have been 16 cases, Indiana 7, Kentucky just 1. But we compare that to Texas this summer.
Right.
537 cases this summer in Texas. Well, what's going on this summer?
Well, it's very hot and it's very dry, so intuitively you'd think, well, maybe that's better for mosquitoes, but in fact it's quite the opposite. The hot temperatures have served to make the mosquitoes a little more randy, shall we say, and the breeding activity is pretty ferocious. I would say that minimal standing water congregates them, concentrates them in a smaller area, and last but not least, it exacerbates the virus. So.
Now, if you happen to fall in the 20% where you do get symptoms, if you have it, at what point do we know, okay, this isn't just a bug going around, this is something a little more serious?
Well, if you've got flu-like symptoms that tend to persist beyond a couple of days, I would have a good long talk with your physician. They're all well aware of what's going on in the area, and will diagnose properly.
No reason, I mean, we never want to put panic in the public, but no reason to say, I can't go outside, I can't enjoy myself for the rest of the summer.
Well, for the vast majority of the population, that's exactly the case. But if you're elderly, if you have a compromised immune system, if you're undergoing chemotherapy or in treatment for any kind of thing that might weaken your immune system, you want to be careful. You want to dress properly, stay indoors when it's mosquitoes are most active at dusk and dawn. Use DEET or other EPA-approved insecticide. Wear long sleeves and long pants. Tuck your pants into your jackets and your
all the things we always heard as a kid, right?
Exactly.
Protect, just like sunscreen. You got to put it on, especially now.
You got it.
All right, Mike. Thanks so much.
My pleasure. Thank you, Brian.
All right.